Take about 18 inches of floss and then wrap that gently round the 2 middle fingers.
Okay, but you need to clean it once a day for 3 minutes.
Right.
And you need to start right the way around on one side of your mouth, work your way right the way around methodically. You can do that, can you?
Yes, I can.
You promise?
I think I can.
Ever get the feeling you're not really being listened to? The problem with communicating patient information on oral hygiene is that by and large people are somewhat resistant to instructions unless they can clearly see how it benefits their particular circumstances. That's why a two-way process, a dialogue, is essential.
Changing behaviours related to health is not as straightforward as just telling people what to do. Information is a crucial aspect of it, but it's not sufficient on its own to make people modify the way they go about doing things in relation to their health. And the obvious examples being things like smoking or drinking or unprotected sexual contact. People continue to do those things despite the information about the risks of those behaviours being very widely available. Following on from the idea that you're trying to help people to recognise the risks of not carrying out a behaviour versus the benefits of carrying this out, what underpins a lot of that is the actual relationship that you develop with the patient. Again, there's an enormous amount of literature showing that health outcomes, people getting better from illness, are predicted by the relationship they have with their clinician. It's not the strength of the antibiotic so much, it's not the procedure that's carried out, but if people feel a trust and an empathy with the clinician who's working with them. It's a very important aspect of treatment, whatever the domain, I think, that is underutilised. What gets neglected often is the sense of the patient and you working together, the patient being keen to come and see you to report back what's been happening and to instill that sense of your enthusiasm in their outcome. It's much more satisfying on both sides, I think.
From the patient's point of view, oral hygiene can often feel like part of a seemingly endless outpouring of cash on health products, medicines, toothpastes, mouthwash, equipment, lotions, potions, whatever. There's no reason why keeping your teeth and mouth clean should be expensive. TP's approach is to provide simple, no-nonsense, good-value oral hygiene products. The toothbrush ranges are well-made and inexpensive, without gimmicks. For example, no uneven filaments. There are evident design flaws inherent in that style. The simple act of brushing for 3 minutes twice a day cannot be overstressed. Attractive, patient-friendly products with strong colours helps encourage this oral hygiene basic. The unique design of handle optimises grip and control to increase effectiveness of cleaning. The long neck helps access the back teeth. Gold and silver brushes are a good, much appreciated means of rewarding the patient and signalling improvement in their oral hygiene behaviour.
It is very important that when we're instructing patients in oral hygiene that we aren't talking at the patient, but that we're discussing with. And part of this might mean that as we give instruction, we have the patient trying what we're teaching. It makes them feel a part of it, makes them also not feel that we're lecturing. Not every method will work for every patient, so you need to understand where the patient's at. Listen to their own obstacles and try to adapt instruction. For the patient who says, I never have time or I get tired standing in the bathroom, then suggest that they brush their teeth sitting on the sofa. Don't use toothpaste. Sit down and brush during only the commercials of an average half-hour television program. They will have brushed for 10 minutes. So these kinds of practical things, adapting to the patient.
When it comes to children, it is crucial to select a brush of the appropriate size and softness. TP also has a broad range of specialist brushes developed in collaboration with various specialist clinics. The texture of the filaments has been adjusted to meet various patient special needs, and the general emphasis is on ergonomic design for better brush control and easier access to difficult-to-reach places, which links to the key oral hygiene issue, interdental cleaning. To a large extent, the battle against tooth decay and oral malodor is won or lost between the teeth.
Most of the patients I see require quite a lot of help in sorting out their interdental cleaning.
It's quite important to get them motivated in that area and to get them to work quite hard at home on that sort of thing. Without that, then it's very difficult for us in the surgery to actually maintain their oral health, both from a dental decay perspective and from a periodontal perspective.
TP's comprehensive range of interdental brushes suit all sizes of interproximal space from 0.4 of a millimetre to 1.1, all colour-coded for ease of use. With ergonomic, easily grippable handles, the metal wire is plastic-coated to ensure comfort, avoid galvanic shock and prevent damage to implants.
There's a lot of evidence that shows that leaving a doctor's consultation, people retain about 10% of what was discussed. So there's a number of ways that you can ensure that people do retain that. After explaining to the patient what's needed to do, asking the patient to feed that back to you, to repeat to you what you said to them, getting the patient to go through the actual procedure you've asked them to do and observe them doing it before they leave. You can shape up or correct any misunderstanding or imperfection in their performance.
Although it sometimes feels like in one ear and out the other, it is essential to persist and motivate patients to keep their teeth and mouth fresh and clean. Once you engage in dialogue and really get across the sense that good, consistent oral hygiene benefits more than simply your dental health, that a healthy smile impacts on your whole quality of life, then the message begins to strike home.